client with us today. His name is Justin, and I'm really happy to have him here with us. He is 16 years old, and he is currently experiencing problems with blackheads. As you can see, I started him on the glycolic wash, and I knew I was going to run a risk of this getting better, and so I asked Justin, how did your skin get better?
Yes, it did.
So basically they were a lot bigger, but that's okay. That's my goal, is to make sure that they get better. But we're going to be extracting today and getting them all out. And so usually when we're doing, a lot of blackheads, it's because maybe sometimes puberty and so forth and so on. With him, it's actually, he's got the most beautiful head of hair I've ever seen. These amazing locks, and they fall like down to here. And so in the summer, he sweats a little more than he does in the winter. He's mostly outside a lot. And so that's what causes the problem. He gets a lot of oils. Oxygen doesn't go into that area. And of course, it causes him to clog. So he should resolve pretty quickly. And so we'll see how his first session goes. So thank you, Justin, for allowing me to work on your skin.
Thank you.
Okay. So we're going to start. We're going to work at the base. And they're pretty receptive. How are you holding up, okay?
Yes, ma'am.
So this is about the pressure that we're going to use, okay? If for whatever reason you find that it's too much, just raise your hand and then I'll back off, okay?
Okay.
A lot of you have been asking about Kay, and I'll be seeing him tomorrow. Of course, by the time we load this up, tomorrow will be a different day. But so he's coming in. He's been busy with school, and so he hadn't been able to come in, but I can't wait to see him. I talked to his mom. They're doing great. He's doing good, and he's clearing up nicely, which that's what we want. So before I started, I did wash his face. Might have mentioned that a little bit earlier, but just in case if I didn't. 20% acid wash. I vigorously scrubbed it on the skin. I know you guys have been calling and writing and requesting my wash. Should have it back in stock soon. Okay, remember, it's all about getting right there on that base of that pore, and that way it'll release all the buildup that's underneath there. I had a question too, which was how much I got paid. Is that what it was, Jody? Something like that. And I don't get paid for doing this, so that way you guys know this. I do this because I thoroughly enjoy my work. It's real hard sometimes to even leave work, or even when a patient comes in, and we usually work on them for about an hour, and it's real hard for me just to even let them go because I want to keep working on their skin. But so I don't charge for they don't give me any money, sorry, for doing any of the videos. Another thing I wanted to talk to you guys about, I need to sit down probably sometime next week and go through some of my emails. I have read them, and you probably have noticed it, but I have not had the chance to respond to them. And so please don't think that I will not respond. I will. It's just that Jotty was on vacation. Yay! Well earned vacation. And so I've just been really busy, and her and Griselle, my other reception in the front, they are just so amazing. Let me open this up here. And they help me a lot, and so it's just been a little hectic, but I will definitely answer many of those emails that have come in and questions, so forth and so on. Okay? Thank you for reaching out to me. I truly appreciate it. I am honored. Okay, so you could see, look at, I don't know if you can see the difference between this area and this area. See how it's nicely cleaning up? Just awesome. And then we'll just keep working. I'm telling you, this is the best job ever. I know some of you are wanting to get into aesthetic school. I would definitely recommend it. It's a very rewarding profession, especially if you're a popaholic. Okay. So at this point, I am going to wash the skin again. And that's just to help pre-soften that area. Anytime I use the wash, now before when I was videoing before, I wouldn't show it, but you guys also wanted to see that, so part of the process. So when I wash, I do wash very vigorously. You want to get that glycolic in there, okay? Now, Justin, you're gonna feel it a little bit, okay?
Okay.
All right. And so that helps to bring to the surface all that oil and content in that pore. And you can see it, how it kind of puffs up. You okay?
Yes, ma'am.
All right. And there we go. I'm going to try to get these little tiny ones through here. I know you said you really didn't want to talk much, but it's just a question. Okay. So you're graduating from high school.
Mhm.
You're in the 11th grade, but you're also going to college at the same time, right?
Yes.
So what are you wanting to do when what have you chosen as a profession?
Well, I want to do plastic surgery.
Yay! Isn't that awesome? That's such a great profession to, to have. So I'm really excited for you. You invite me to your graduation, okay?
Okay.
All right. Okay, so you go back and you double check, make sure that it's nice and clean. I'm gonna just wash this area. So this is a little stubborn, Justin, okay? But it came out. You okay?
Okay.
Survived?
Yeah. Mm-hmm.
All right. Go ahead and open some of these. It's a little bony area here, the forehead, so it can be a little bit uncomfortable. I'm gonna try to make it as comfortable as I can, okay? Not a lot of fatty tissue here. Again, I'm going to go here and just kind of open some of these. They're very small. Okay, we're going to stretch, go on that base. Stretch on that base. Stretch and on that base. Okay, go on that base. I'm going to wash a little bit again. Okay, I'm going to just double check through here. Like I said, this is kind of like a very bony area, and you can see the little tiny ones coming up to the surface. we're gonna go ahead and do this area here, temple area. And it's a sensitive area. It's kind of thin. Okay, and so you can see there's build up there, so you definitely want to go ahead and remove all of that out. Okay. How are you holding up?
Pretty good.
Pretty good? Okay. So what I'm gonna do is gonna go ahead and wash this area again. It's got a little bit more fatty tissue. All right, we're gonna go ahead and go through here. Got that out. Okay, so this is his first time with us here, and so you know, when we have a patient that has never had any treatments done before, we really don't want to overwhelm them. I like to see them again, and I don't want to scare them off. Right, Justin? You're coming back?
Yes.
Okay. So what I'm going to do is I'm just going to clean up here, and then we'll show you a before and after the little bit of the area that we've done. He does have a lot of blackheads, but again, I want to be conscious of just so that he can start acclimating to the treatments itself. I'm going to just do a couple of more and extractions, and then we're going to go ahead and say goodbye. Okay, you guys? Thank you for your patience with us. Thank you for walking with us through this journey with Justin on clearing up his skin. We look forward to seeing you guys again. I truly appreciate your support. Welcome, Justin, to our Popaholic family. Make sure you write a comment on there and tell us how you like the video. Share this video with your family and your friends. And look us up on Instagram. Look us up on Facebook and like. God bless you guys. And take care, and we'll see you soon. Bye-bye.